Maternal mortality in the U.S. is on the rise, according to new research. A study published in JAMA Network Open found pregnancy-related deaths rose nearly 28% from 2018 to 2022. The study analyzed deaths up to a year postpartum. Almost one-third of the deaths took place after 6 weeks of childbirth.
The sort of the image that we have where women are delivering their babies, they're in the hospital, they're in a birth center, and they die in childbirth. It does happen, but maternal mortality itself is calculated under a much broader set of criteria for determining how and when a mother died.
Researchers found that cardiovascular disease, cancer, mental disorders, and drug and alcohol-induced deaths were the leading causes of late maternal deaths. Dr. Ingrid Skop with the Charlotte Lozier Insititute joins us now to share her thoughts on this study. Dr. Skop, if these deaths are related to cancer or alcohol abuse, why do researchers link them to pregnancy and those who have recently given birth?
So a pregnancy-related death is defined as caused by the pregnancy itself or exacerbated by the pregnancy or its treatment. So in the case of cancer, perhaps those evaluating the death thought that the treatment might have been different because she was pregnant, or in the case of a mental health death, they may have discovered the answer to the question, was she depressed or despondent perhaps because of an adverse outcome, an induced abortion or a stillbirth? The question that's answered is, if she had not been pregnant, would she still have died? The good news is we're seeing deaths related to catastrophic events at the time of childbirth going down. So sepsis, hypertension, hemorrhage, thrombotic events. Doctors and hospitals are getting much better at caring for women with emergencies at childbirth. We have protocols, we have training drills. The bad news is deaths related to chronic illness, deaths related to advanced maternal age, and deaths related to mental health causes are going up. Also, in regarding this study, COVID-19 pandemic affected women severely. So there were many deaths related to that, and I think that's reflected as well.
And what is the time period after giving birth that doctors recommend coming in for a checkup? And has this timing changed recently?
Traditionally, we would bring a woman in about 2 weeks after a cesarean, about 6 weeks after a normal delivery. But recognizing that so many deaths are occurring after childbirth, for example, if a woman has hypertension, we may bring her in just a few days or a week for an exam. And also, we're much more aware of mental health issues. And so we have concerns about a woman, we'll bring her in earlier to evaluate her mental health as well.
What do you think can be done to prevent these deaths?
Well, I think we need awareness of what the crisis really is. We do have a crisis in this country. Our maternal mortality is the worst in the developed world, and that is abhorrent. But again, we need to be educating women about having their children at a younger age. Women who wait until they're 40 or 45, have established their careers, they're going to be more at risk. We need to be helping the population become more healthy before pregnancy occurs, decreasing those chronic illnesses that put women at risk. We need to really be thinking hard about why do we have such a mental health crisis and how can we help women. And really, the racial disparities are quite concerning. But one thing that we see is that the groups that are most affected by maternal mortality have the highest rates of single moms living in poverty, often affected by chronic illnesses, but also by family breakdown. So I think this is something that is not discussed enough. How can we prioritize the health of a family so that women are not as likely to live alone in poverty, and if they should become ill, that they have a social support network that can help them, get them into the doctor so that they get care in a timely manner.
I think all of these social issues that you've mentioned are very important. I think right now there's an opportunity in the pro-life movement to kind of address some of these. And in your perspective, what role would maybe nonprofits, apostolates, the church, and maybe even the government have to play in this to walk alongside doctors and these mothers who may be struggling with mental health, who might be single mothers and may be struggling with poverty?
Yeah, excellent question. So there are so many organizations working on this, and I do give them credit for the great work that they're doing. The government, of course, providing Medicaid for a full year postpartum so that a woman does not lose her health insurance. That's very important for women with chronic illnesses because, again, we saw many of those women get sick and sometimes die beyond 6 weeks. Because in many cases, we count pregnancy mortality up to a year after the end of the pregnancy. But I work very closely with pregnancy centers, and they offer counseling for mental illness. They offer support for families. They help women to discover the resources that they need. And this is critically important. So the government has a role, but I believe that nonprofits do have a role in support, and the church needs to be aware of this issue. We need to be speaking out about the things that are in our ballpark, which is morality according to what the Bible says, and the family as the root of society, as Pope Leo just mentioned. This is critically important. I believe if we did not have such a devastating family breakdown in so many of our communities, that we would see maternal mortality improve dramatically in those communities.
Well, Dr. Skop, thank you so much for your time, and thank you for that call to action and for just giving us such a insight into this very complicated landscape.
Thank you. It's great to be here with you.